All right, so it is recording. I'm Caitlin Popkin.
And we're talking about relational autonomy as an essential component of patient-centered care. So patient-centered care is when healthcare professionals individualize their interactions with each and every patient. So the patient would be more of a partner in guiding what kind of care they receive. But this seems to struggle when we try to implement it in actual healthcare settings. And this is where we'll talk about relational autonomy and how that would help implementing patient-centered care. So there's some challenges in the practice in patient-centered care. Because patient-centered care is more of a partnership, it requires a lot more planning and flexibility from the clinician. Rather than focusing on the average patient, the clinician has to look at each individual patient as their own person with their own interests, likes, and motivations. And this will lead into the 5 factors and the challenges in practice.
Yeah, and with this, I noticed in the reading that a lot of it was time issued, like a very limited time, because even if a patient comes in for something minor, it's hard to get to know someone in like a 2-hour time span.
Yeah. And what I think would really help is we're going to talk about that psychosocial assessment. And when you're doing all of that paperwork, like, you're sitting in the waiting room, filling out all that paperwork, I feel like that should be a part of the paperwork. So that way the doctor can go through it and know the person at least a little bit before they even meet them.
Yeah, or even as they're doing things like checking like their vitals, some of the basic things, talking to them, just doing it as you go, not making it something specific during a specific time, because it will make it go quicker.
Yeah. I went to the doctor actually recently. We're not going to talk about what it was, but I was just getting like my vitals read, and they were like talking about my symptoms, but they were just talking about me as a person, trying to get to know who I am. So they were more comfortable talking to me overall and asking me medical questions.
Yeah.
So the 5 factors that most challenge patient-centered care is ambiguity in the definition. So a lot of people don't really understand what patient-centered care is, and we have already talked about it. It's more of a partnership where the patient has a say in where their care is being directed. And there's a narrow application in the model when you read about it in literature. So when you read about it in articles, they don't really know how you would implement it in a normal healthcare setting. There's small amounts of empirical data on the model, so there hasn't been a lot of studies done about the effects of patient-centered care in a healthcare setting, so we don't really know how beneficial it is. And there's features in clinical education that challenge patient-centered care. A lot of clinical education, they tell you to almost act robotic. You're looking at a person with symptoms and you're trying to get a diagnosis. You're not looking at a person with interests and likes and motivations and other things that would factor into their care. And the organization of healthcare settings. So this is where the time orientation becomes a big problem. Organization of healthcare settings, usually doctors are dealing with 20 patients at a time and not just 1 or 2 where they can get to know them very well.
Yeah. And going off that was also, I know they mentioned in an article like scheduling, like not enough staff, because they have so many people. As you said, they can't get to know everyone. And that goes along with needing more healthcare workers. So then they have less people and to be able to know them more. And on the empirical data, I know they talked about some studies that in the few studies they've done, they patients and family members do enjoy person-centered care a lot more. They're more satisfied. They feel more involved in the decision making with it. And most of the professionals doing it also like it. They feel that they get a sense of that the patient actually understands what's going on and really is sure of their decision.
lot like a trust thing. Like when the doctor is really trying to get to know you, you get to know the doctor as well. It goes hand in hand. So when you're dealing with somebody and you don't really know them, it's hard to trust where your care is going. And that's where patient-centered care would really help, I think.
Yeah.
Patients, this is when a patient's freedom to choose what happens to their body, medical information, and integrity comes into play, which tends to contradict and outweigh acts of paternalism by doctors. So when a doctor tries to do something for your own good, your autonomy can outweigh that because it's your choice.
Mhm. And I know in the article it talked a lot about um, the issue with autonomy and person-centered care was the kind of vagueness that was laid out, that they did it, that it was kind of overlapping with some person-centered care wasn't respecting autonomy, and like that goes along with like laying out, like educating them more so they know kind of the fine line between autonomy and letting the patients like discuss with the doctors and having the doctors weigh in as well.
Education, but I think it would be a really good idea to have even like courses designed around person-centered care so the clinicians really understand like how that will go. Because I feel like there's a lot of confusion right now.
Yeah.
Autonomy, which was developed by feminist philosophers. And it's the idea that identity is formed around a social environment. So this kind of autonomy emerges through relationships. And these relationships, whether they're good or they're bad, can promote or hinder a person's sense of autonomy respectively. So if you're coming from a great family and awesome relationships, you have a really good sense of autonomy and what you want done to you and your choices and your freedoms. But on the flip side, if you've come from bad family relationships and things like that, you don't really have a good sense of self and what choices you want to make. So the clinician has to work with that patient's sense of identity, no matter what it is, in order to guide their care when it comes to person-centered care.
Mm-hmm. And this one, they said, seemed to fit the most with person-centered care was the racial autonomy. And I liked in there, it said somewhere that working with the patient's sense of identity gives you a chance to kind of like adjust to what they're feeling, kind of like as their lives change. And it really gives them a chance to know them better and to focus on the patients rather along with the healthcare, not just one or the other, or not just focusing on the patients and overshadowing the healthcare being provided.
Because I completely agree that your identity emerges from the people you surround yourself with. And that's what forms your interests and your likes and your motivations and your hobbies. And that's what forms the whole person. And the whole idea is that the clinician's looking at the patient as a whole person. So I feel like you really need to understand where that person comes from.
All right, so education of patient-centered care and autonomy. So educating people on like not only the professionals, but the patients, the family members on autonomy skills allows them to better understand like kind of their rights in the healthcare, kind of allows them to form a better sense of self-identity. And this, along with it, helps them be less confused about what they are wanting to do in the healthcare situation. And education of patient-centered care is a real big issue in this article. Of a lot of is patient-centered care is a good option, but a lot of professionals aren't educated on it enough to use it to the standard that it should be used. And this goes along with helping like laying out like directions so people are less confused on what exactly is going on, and even giving them classes like you said earlier with better skills to improve the process, like communication skills, like interpersonal skills, and like speech skills, even like so they can be able to talk, like have a conversation with the family members and the patients better. It just will give people a better understanding of what's going on. Even the patients, they need to be in the loop of what type of care they're getting.
And I know I've been in that situation where you're talking to a doctor and they're telling you what your best choices probably are. And I'm sitting there wanting to maybe try something else, but he's the doctor. And I don't feel like I should be speaking up because he obviously knows more than me.
Mhm.
But I feel like educating patients and family members, telling them that they do have a voice in their care and it's a partnership rather than the doctor telling you what to do, is super important to make them feel more comfortable in the care they're getting.
Yeah. Yeah. And then the psychosocial assessment is a key that can be put in place that could help a lot with the person-centered care, kind of get you right on the right track. It helps professionals understand their clients better, like how they think, learn, and what influences them. This then in turn gets the doctor, the physician ready to like maybe kind of know what's making them, what's like leading them to the decision they're making, so they can better understand why that's the best decision. It also helps patients and family members figure out what's important, their values, and the effects of the illness. It kind of going through the psychosocial assessment can just give clarity to the patients by them like speaking out what they believe to someone else. It shows them this is why I want to pick this option for healthcare, or I'm going to focus on this part of my life. Maybe this part I don't really need as much, or like can be affected just a little more. And like overall, determining what the effects of the illness is going to look like on their lives. And is that illness going to impact other parts of their lives? It's a This goes along with, like you said, the questionnaire that we did in class. This is just a good starting point for person-centered care.
On our homework, talking about the time constraint that goes along with this questionnaire, and I talked about maybe putting it in the baseline paperwork, like with your insurance paperwork and everything else, and maybe even making the list shorter. But it gives the doctor a good baseline to maybe ask further questions during like the first checkup, like getting your vitals done, so they can get even more information and they know where to start. Like they're almost good icebreakers, even like for the doctor to
Yeah.
get to know the patient too. But it's
And
a good way to see like how they're making decisions.
yeah, and even on like shorter questions, like maybe even broader ones that you can build off of. So like
Yeah.
I know in that it was like your neighbor, what's your neighborhood, who are your neighbors, describe them. Maybe making a broader one, like tell me about your neighborhood.
Yeah.
Like so then you can build off it, and that would help with the time. And maybe even you get more in depth, like just
Mm-hmm.
having a conversation back and forth instead of just straight questions.
I really do think that this is a good way to jumpstart patient-centered care. And relational autonomy really plays a part in that psychosocial assessment.
Mhm. Yes, that is. All right.